हेलो वेलकम बैक। गुड मॉर्निंग टू ऑल ऑफ माय डियर व्यूअर्स। हाँ, लेकिन अभी तो नाइट जैसा लग रहा है। ओके, कोई बात नहीं है। ठीक है। तो इन टुडे सेशन वी आर गोइंग टू डिस्कस अ वेरी इंपॉर्टेंट टॉपिक्स ऑफ फोरेंसिक मेडिसिन एंड द नेम ऑफ टॉपिक इज व्हाट? Abrasion. So what is this abrasion? Understand what is the meaning of this abrasion? Abrasion is basically it is types of mechanical injury due to blunt forces. So what I am telling to you, it is types of mechanical injury due to blunt forces. So what happens in case of abrasion? In case of abrasion, there is damaging of superficial layer of the skin, which include obviously the epidermis and the superficial layer of the dermis. So these are the two layer of the skin which are commonly affected in case of the abrasion. And in case of abrasion, there is healing without a scar formation. So these are the two important points related to the abrasion. One is the obviously there is superficial damage of a superficial layer of the skin get damaged, which include the epidermis and superficial part of the dermis, and which is healed without a scar formation. So this is all about the, or not all about, so this is overall about the definition of abrasion. Okay, so now after discussion the definition of abrasion, now we move towards the types of abrasion. So there are commonly four types of the abrasion, and in one of the most common is graze abrasion. So what is this graze abrasion? Graze abrasion क्या है जी? Let's see. Graze abrasion is it is due to the sliding of body over the rough surface. So whenever any body are dragging over the rough surface, in case of commonly in case of the road traffic accidents, so there is peeling of the skin, and there is accumulation of peeled epitheliums at one end. We call it as the heap of epitheliums. So it is one of the characteristic feature of what? This graze abrasion. So what are the definition of this graze abrasion? It is the type of abrasion due to the sliding of body over the rough surface, which is characterized by presence of heaped epitheliums or a parallel lines. This parallel line indicates the direction of what? Direction of injury. Okay. So now the next abrasion is linear abrasion. What is this linear abrasion? It is also called as a scratch abrasion. So whenever any abrasion having a significant length but insignificant width, we called such types of abrasion as a linear abrasion or a scratch abrasion. Commonly seen in case of assault due to the nail mark. The third types of abrasion is pressure abrasion. So it is a pattern abrasion due to applying a small force for a long duration. So whenever there is applying a small force with a long duration of times, it causes what? Pattern abrasion, which include let's say in pattern abrasion, it include two types of abrasion. One is the imprint abrasion and another is pressure abrasion. So this pressure abrasion is also a types of pattern abrasion, which is develops due to the applying a small forces but for a long duration of the times. It is commonly seen in case of the hanging and strangulation. If the ligation mark is oblique, we consider it as a hangings, and if the ligation mark is transverse, it is considered as a strangulation. Okay, the fourth types of abrasion is imprint abrasion. So like pressure abrasion, it is also a pattern abrasion, and it is characterized by what? It is characterized by presence of the tire marks in case of road traffic accidents, and teeth mark in case of assaults. So this is all about the abrasion and its types. Now we move toward the reading section. Okay, so we start the topic with definition of abrasion. It is a mechanical injury. What is this? It is a mechanical injury by applying blunt force in which there is damaging of superficial layer of the skin, which include mainly epidermis and the superficial dermis, healing by without a scar formation within 1 hour. So the same things I already discussed with you. It is due to the applying blunt forces, mechanical injury due to the apply blunt forces. Okay, and the next things is the healing without the scar formation. The types of abrasion, one is the most common types of abrasion is the graze abrasion. It is also called as brush burn. Okay, so why this graze abrasion we called it as a brush burn? Because it is looks like a burn injury. What happens if sometimes what happens, it is observed that when the abrasion is fresh or it is less than 12 hours, it looks like a burn injury. So whenever any abrasion is looks like a burn injury, we called such abrasion as a brush burn. ठीक है भाई. Okay, it is abrasion due to the sliding of body over a rough surface cause peeling of the skin. So what is the definition of this graze abrasion? It is abrasion due to the sliding of body over the rough surface, which is due over the cause peeling of the skin. Okay, peeling of the skin is one of the characteristic feature of any types of abrasion, not only in case of graze abrasion. It is characterized by the appearance of parallel line over the skin that you can see in case of these figures. It is characterized by the presence of parallel line, and this heap up epithelium it indicates the terminal ends, and it tells about the direction of the slidings. The direction of sliding is always towards the heap up epitheliums. Okay, example, dragging of body along with rough surface during the road traffic accidents. The next important abrasion is linear abrasion, and in case of linear abrasion having a significant length but insignificant width, commonly seen in case of assault due to the fingernail scratching. Okay, the next thing is the pressure abrasion. It is a pattern abrasion. It is a pattern abrasion characterized by presence of ligature marks. If the ligature mark is oblique, it is indicative of hangings, and if the ligature mark is transverse, it is indicative of a strangulation. Okay, the fourth thing is impact abrasion. It is also a pattern abrasion due to applying large forces but a less duration of time. What is the difference between this pressure abrasion and the imprint abrasion? Both pressure abrasion and imprint abrasion, they are types of pattern abrasion, but in case of imprint abrasion there is applying large forces with short interval of times. But in case of this pressure abrasion, there is apply a small amount of force but for long duration. So this is a common differences between the imprint abrasion and the pressure abrasion on the basis of extent of applying force. The next important topic is the age of abrasion, and this age of abrasion is written in the form of mnemonics RRBB. So if the duration of abrasion is less than 12 hours, it is appear as a red without a scab. What is this? A scab? A scab means it is a collection of clot and the tissue fluids. Okay, reddish abrasion, when reddish abrasion will be appear, it is within the 12 to 24 hours, and if the abrasion is looks like reddish brown, it is most commonly it is 2 to 3 days abrasion. Brownish scab 4 to 5 days, and blackish scab 6 to 7 days. Let's see if you can absorb, if you can observe any abrasion and it is looks like a reddish, it is indicated a fresh abrasion. But if it is looks like a blackish, it indicates that abrasion is 6 to 7 days before. I mean abrasion is occurred 6 to 7 days before. Medical legal importance, it tells about the site of impacts. So by seeing the what abrasion, we can conclude that what are the site of abrasion. If it is present over the forearms, that means obviously the site of abrasion is, I mean site of forces over the forearms. Tells about the direction of forces by looking the hip-hopped margins. Edge of abrasion I already discussed here. Next is the manner of abrasion. It is graze linear pressure imprints, differential diagnosis, ant bites. So what happens, it is sometimes observed that when a dead body is kept in a post-mortem rooms, due to the ant bitings, there is appearance of a ligation marks, which is no, which is get confusing with what pressure abrasion. So this is one of the differential diagnosis of the ant bites. Second is pressure sores. So in case of bedridden condition, if any patient in a bedridden for 2 months 3 months, so due to not changing its position, there is developments of ulcer in its skin, and which also confused with what some postmortems, some postmortem contusion, not some not contusion, it is topics of abrasion. So why why it is comes contusion, let's see. If any person they lay down for more than 2 or 3 months, so they develops a ulcer in dependent parts of the bodies. So this ulcer is a antemortem, not a postmortem findings. But since ulcer are present over the body, so sometimes it is confused as a postmortem findings. Okay, let's see. Nappy rashes. Nappy rashes, it is due to the infection. So this is all about the abrasion. Welcome back in new session.